If you have diabetes, you are probably constantly dealing with inflammation. Adding spices to your diet can be an excellent method to counteract this. Many spices, after all, are regarded for their significant anti-inflammatory qualities. Reduce blood glucose levels. Lower oxidative stress. Reduce inflammation while increasing insulin sensitivity. Spices, like any other food, have advantages and disadvantages. Some can be highly potent and harmful to some bodily systems. Diabetes has already harmed. That is now too delicate. So, what exactly do you need to know about spices? And which should you stay away from? To avoid more damage to your blood glucose and diabetes? Keep watching and don't go anywhere. We'll go over the 5 worst spices for blood glucose control in this video. But, before we begin, could you please do us a favor and like this video? To receive future notifications, ring the bell. Now, let's look at the 5 worst spices for blood glucose control. Begins with Number 5. Cinnamon. Cinnamon is a delicious spice that we enjoy adding to hot beverages and pastries. A modest amount of this spice has been related to health benefits for inflammation and blood sugar control. Cinnamon, on the other hand, is a spice with a few drawbacks. Excessive cinnamon consumption may increase the risk of cell toxicity. It can also cause your blood glucose level to drop dangerously low. Cinnamon mimics the action of insulin on blood sugar levels. Diabetics are at danger of hypoglycemia if they ingest too much of it. According to one study, there is a substantial difference between blood glucose levels. Participants who consumed either 1 gram, 3 grams, or 6 grams of cinnamon per day for 40 days were more likely to have hypoglycemia. Hypoglycemia with type 2 diabetes increases the risk of complications considerably. In short, keep your cinnamon usage to a minimum. Number 4. If you're diabetic. Flakes of Lee chili are a hot spice made from pepper. Paprika is one of them. Slices of cayenne pepper or jalapeno. This might be very heated and harmful to a fragile digestive system. Consuming chili flakes may cause abdominal ache, burning sensation in the stomach, in addition to increasing inflammation. It has been demonstrated that inflammation has a major impact on insulin resistance and imbalanced blood glucose levels. Recent research has shown that uncontrolled inflammation can have a negative impact on the body. Increases the risk of chronic illnesses by impairing glucose tolerance and control as well as diabetic mellitus. The gastrointestinal tract is already irritated. It is advisable to avoid using chili flakes. Number 3. If you want to enhance your immune system, ginger is an excellent spice to use. However, it does have drawbacks. Potential hazards if you have diabetes. I enjoy chili. Ginger can induce the following side effects: heartburn, diarrhea, and a tummy ache. Ginger is frequently not recommended when ingested in big quantities. If you are susceptible to hypoglycemia, according to a big study, using ginger can significantly increase fasting blood sugar levels, A1C hemoglobin, apolipoprotein B, apoprotein B. There's also malondialdehyde, which can increase the likelihood of a major dip in glycemia in type 2 diabetics. Experts advise taking no more than 4 grams of ginger each day to prevent hypoglycemia. And, like ginger, another spice has comparable properties that you should be mindful of when it comes to your diet. Obesity and coronary heart disease are on the rise at an alarming rate. And I discovered what truly works. And now, let's look at some more spices to avoid for blood glucose control, starting with the second point is another spice that has been recommended for diabetics as turmeric. It contains a lot of anti-inflammatory characteristics that can help with blood glucose control. However, turmeric has a number of drawbacks that you should be aware of prior to ingesting this spice, similar to a variety of different spices. Turmeric has been demonstrated to have side effects including discomfort in the stomach, toxicity of cells, hypoglycemia with kidney stones. Experts observed indicators of toxicity during a trial after the healthy volunteers were given an increased dosage of turmeric, approximately 500 to 12,000 milligrams. Toxicity in the blood can result in glucotoxicity, a disease that damages beta cells, and raise the chances of diabetic complications and insulin resistance. Overall, it is advised to minimize your daily intake of turmeric. To avoid toxicity, limit the dose to a maximum of 2000 mg. Number 1. Black pepper, one of the most popular spices used in cooking. Black pepper may appear to be a safe spice for diabetes. Furthermore, while tiny doses are typically appropriate, it is quite typical to consume an excessive amount of black pepper, and not necessarily beneficial to diabetics. Too much black pepper on your dish might have negative consequences, including stomach pain, diarrhea, in addition to blood thinning. That's correct. When taking black pepper, you should keep an eye out for hypoglycemia. An experimental research discovered that rats who consume a lot of black pepper are more prone to have hypoglycemia. While further human study is needed, it is advisable to limit your black pepper usage to 20 mg per day. In general, as a diabetic, I avoid any spices. However, it is advisable to consume them in little amounts to avoid influencing inflammation and increasing your risk of hypoglycemia. That's all there is to it. We'd like to hear from you now. Which one has surprised you the most? And which spice will you pay closer attention to? Comment here to share your ideas with other diabetics. Remember to subscribe to our channel and press the bell button for more videos. Thank you for your time. We wish you a successful diabetes fighting day.